Hi all, this is Priyadarshini from SNS College of Physiotherapy. Now I am going to tell about AIDS, which is caused by HIV, which comes under the title of infection under the subject General Medicine, General Surgery, Pediatrics and Geriatrics. Now we are getting into the topic. So AIDS is one of the advanced stage of HIV infection, which leading to the severe immune suppression disorders or diseases. HIV is otherwise known as human immunodeficiency syndrome or virus, which attacks the immune system of the human body or the host cell, specifically CD4 plus or T lymphocyte cells, which is also known as helper cells. The global impact it affects the million people and but manageable during the treatment, but it is ceases. Etiology, now we are going to see about the etiology of HIV. It is caused by AIDS is caused by the HIV virus, HIV-1 and HIV-2. HIV-1 is the most commonest type of AIDS causing virus. It comes under the retrovirus belonging to the lentivirus family, and its structure is RNA virus with envelope glycoproteins which attached with the CD4 plus or T helper cells of the host cell. Epidemiology, according to 2024 data, roughly 40.8 million people were living with HIV, and it is high in the high prevalence states. Transmission mainly by the heterosexual people. And the risk factors or risk groups are sex workers, MSM, IDUs, and blood transfusion recipient, not the donor. Mode of transmission, it mainly transmit due to the sexual contact, blood-borne, mother to child, and not transmitted via casual contact with the affected person or the mosquito, etc. So pathophysiology, now we are going to see about the pathophysiology of HIV. HIV first attacks and bind with the host cells, CD4 plus cells or T lymphocyte helper cells, and it enters into the cell and replicates using reverse transcriptase. It may lead to the CD4 plus cells to depletion, and it causes the immune dysfunction. The progression like acute stage, chronic stage, and AIDS. It is the progressions of HIV virus. The key enzymes are reverse transcriptase and integrase protease. Stages, there are 4 stages of HIV. Stage 1 is asymptomatic, stage 2 is mild symptoms, stage 3 is advanced symptoms, and stage 4 is severe symptoms. So clinical features of HIV are fatigue, sore throat, diarrhea, night sweats, muscle aches, rashes, fever and chills, swollen lymph nodes, mouth sores, etc. are the clinical features of HIV. So now we can see the clinical features by stage. In early stage, that is in acute stage, the fevers, rashes, and lymphadenopathy, sore throat are the common clinical features. And in the chronic stage, weight loss, fatigue, recurrent infections are the most common clinical features of AIDS. In severe symptoms like wasting syndrome and dementia may also occur in the AIDS. Opportunical infections are pneumonia, TB, candidiasis, and CMV retinitis. Kaposis sarcoma are the other opportunistic infections. Diagnosis: HIV can be identified and diagnosed by the test known as ELISA test, which is for the antibodies screening. Confirmation test is Western blot or PCR for viral RNA present. Monitoring CD4 count and viral load are the monitoring diagnosis of HIV or AIDS. Management: it is mainly manageable but not be curable. Antiretroviral therapy, which suppress the viral load and restore CD4 count. NRTIs example Zidovudine and efavirenz, lopinavir, and dolutegravir are the medications for HIV. Supportive care, that is ventilation support, and to treat the opportunical infections, example antifungal infections, as the supportive care of HIV or AIDS. Prevention, it can be prevented mainly through the safe sex, needle exchange before screening, and art of pregnant women, so they should take the PMTCT test, and education and awareness about HIV are the preventive measures. Summary: HIV causes AIDS by destroying immune cells. Diagnosed early, treat with ART, prevent transmission. Physio role, rehab and quality of life improvement are the main so now we are going to discuss the questions, discuss the etiology, modes of transmission and clinical features of stages, diagnosis and management and prevention of AIDS. They may ask the same question either in like AIDS or HIV. Next question is describe HIV infection in detail, add a note on opportunistic infections and their management. Enumerate viral infection, discuss AIDS in pathogenesis, diagnosis, treatment and preventive measures. Write in detail about the complication of AIDS or HIV and the role of rehabilitation physiotherapy in their management. These are the possible questions of AIDS under the MGR University. Thank you and see you in the next video.